Well, we've had the TENEO Model 2 for the past 1.5 years. I'm practicing primarily transepithelial PRK with the default ProScan spheric profile. And when Octavius was launched and approved last year, 2024, we're excited to see what it could bring to the table in terms of correcting both normal and abnormal corneas. ProScan delivers an ablation profile based on each individual cornea's K and Q values. But bear in mind that K and Q values are representative coefficients and localized corneal abnormalities may not be treated. Octavius customizes each ablation profile by treating localized corneal abnormalities, and this is just a feature that's not available with default spheric ablation profiles. While results are fairly early now, our cohorts at 3 months, when we examine visual acuity, we find that the results of Octavius are similar to ProScan. When we examine the safety, we're happy as no eyes with Octavius lost 2 lines or more. Examining the efficacy, 80% of our eyes in the Octavius cohort achieved 20/20 at 3 months post-op. However, bear in mind, these were all surface ablation procedures. Therefore, a little bit more time is needed in order to determine the long-term outcomes with Octavius. There is a very subtle trend of Octavius outperforming ProScan in terms of induced and total higher order and spherical aberration with a correspondingly slightly better log contrast sensitivity score. So when we examined the patients at 3 months, we asked them if there were any discernible differences in night vision glare and halos, and the feedback was that there were no discernible differences between ProScan treated eyes and Octavius treated eyes. Our initial experience and our initial impression is that Octavius is similar to ProScan in treating healthy eyes with mild to moderate myopia. However, we feel after applying Octavius off-label to highly abnormal corneas, we find that the true value of Octavius may lie in treatment of abnormal corneas, for example, patients with corneal scars or post-operative complications.